Lower back pain, especially when it radiates down the leg, is quite a common problem. I once had a case where a woman was brought in as an emergency who simply couldn't stand or walk at all. She was experiencing excruciating shooting pain down her leg. What is this? This is compression of the sciatic nerve, and the root of the problem is actually much higher up. Stay with me until the end and you'll find out why this happens. What causes this kind of pain? And most importantly, what can be done about it? What does conventional medicine do? It uses nerve blocks. Blocks with what? With lidocaine, novocaine, and other medications. The goal is, first, to relieve the pain, and second, to relax that very muscle. And of course, when the problem has already become so advanced, very often you have to resort to such radical methods, to invasive methods, when you need to inject some kind of medication, in order to relax this muscle and relieve the pain. But it's important to note here that, once again, we're coming back to swelling in our body. What is swelling? It's stagnation. And stagnation is the perfect environment for inflammation to develop. Inflammation occurs in a very interesting place, in the area of the piriformis muscle. Very often, the piriformis muscle is a muscle that lies above the gluteal muscles, above the large and medium gluteal muscles. And when it becomes inflamed, it goes into spasm, and right underneath it lies a nerve which it starts to press on. And it is at this very moment that the piriformis syndrome occurs. What can be done? First of all, try to deal with the swelling in your body. Take a closer look. On the other hand, check if your face is swollen in the morning, or if you have problems with your kidneys, pyelonephritis, nephritis, glomerulonephritis, and so on. If none of these issues are present, but you still have this problem, then most likely, once again, your body is lacking fluids. Secondly, we return again to our intestines. Chronic inflammation in the intestines causes the mesentery to contract and start pulling on itself. This affects the lumbar region of the spine, causing these micro displacements, which again lead to swelling. So swelling is that kind of symptom. But the causes of swelling, yes, they flow together like little streams from all directions. And by eliminating these chronic inflammations, you can achieve truly incredible results and get rid of pain, not just at the level of symptoms, not just when a patient comes to me in an acute phase with pain, shooting sensations, unable to move. Yes, I can relieve her swelling, I can do something, yes, I can give her a nerve block, I can do some manual therapy techniques to make her feel better, right here and now. But the problem is, that doesn't solve it. What really solves the problem is systematically working on your own body. And our body, our organism, is designed in such a way that if you just create the right conditions for it, it will start to heal itself. The next cause of lower back pain is a scar on the anterior abdominal wall, either from a cesarean section or from an appendectomy, that is the removal of the appendix, or as people say, the removal of appendicitis. Although that's not correct, because appendicitis is appendicitis. It means inflammation of the vermiform appendix. We don't remove the inflammation. Here, unfortunately, surgeons simply remove the appendix. This leaves scars on the anterior abdominal wall, which pull in the fascia. This fascia starts to tighten in one spot and causes pain in the lumbar region of the spine. And by the way, maybe someone has noticed this in themselves? Let us know in the comments if you have. Along with pain in the lumbar spine, it's very common to also have neck pain and headaches. I once had a patient like this. She was about 25 years old. When she was just 19 years old, she underwent surgery for an ovarian cyst, and then, just a few short months later, she tragically started experiencing constant, debilitating headaches, persistent neck pain, severe lower back pain, and one of the important things was that she just couldn't gain any weight. We worked on the scar, we separated it from the anterior abdominal wall, the post-operative scar, and her headaches, lower back pain, and neck pain went away. That's how interconnected everything is in our bodies. And how can you check if a scar is bothering you? It shouldn't be adhered. For example, I have one myself. I have a scar from an appendectomy. Here it is. Look how mobile it is. It's absolutely not adhered. At one time it was adhered, meaning that when I lifted it, right here, a similar bulge would form. What did that lead to? It led to the fascia, which attaches to the muscle, being pulled tight, and right along this kind of meridian, it caused me pain in my lower back. That's why we work on the scar, we work on chronic inflammation, and you'll be happy. Your lower back pain will decrease by at least 50%. So how do you deal with chronic inflammation? I talk about this in my free webinar, and I'll leave the link below this video. Go ahead, sign up, and I'll share a lot of useful information with you. And perhaps with a more complete understanding, you will truly comprehend the fundamental reasons why a significant 90% of all your dedicated efforts and persistent struggles to effectively combat your various illnesses have, regrettably, not been successful. Now here's an exercise that can also help relieve lower back pain. What do we do for this? We carefully kneel down, then gently curl up our bodies like this, stretching our arms as far back as humanly possible, and then we try to hook them together if we can manage it. Behind our feet. And we lower our head as much as possible, relaxing it too, and just lie like this for about a minute. In this simple way, we stretch our spine, relieve the pressure on it, and your lower back should feel better right away.